Welcome to Black Health Matters. I'm Darryl Armistead, your host. This episode is a Zoom recording of Howard University group session led by Dr. Clive Callender.
Right, so we can dedicate this session to John Robinson's memory. Any questions or comments about Dr. Robinson?
What was his, what did he die of?
He had a bad heart.
Okay.
Yeah.
Wow. I met him in 96 when David had his first transplant. And he was very patient, very kind, even funny. He was always very supportive. And with that meeting in 96, he followed David and I. I was communicating with him, I think it was last week. I sent him a text. He did respond. When David went in for heart surgery in 2018, he was there, he visited. He was always very patient. I appreciated him. I considered him a friend.
Yeah. So, and he'd been in hospice for the last couple of months. Yeah. So.
And I remember that he was very multi-talented, just not in psychology. Learned that he was a priest, he was a musician, he has all sorts of different outside of psychology. And the way that he stated things, it just kept it so real. And he was just a fascinating man, just to know personally.
Fascinating and interesting. He was a world traveler and
Yeah.
he would share. Yeah.
Uh-huh.
And he was not shy to share his knowledge and experience.
That's right.
Or his viewpoint, even if it was Dr. Callender.
Right.
Yeah.
Yeah. So.
I
But,
never met Dr. Robinson, but I remember James talking a lot about him and how he had a lot of respect for Dr. Robinson, but I never got a chance or opportunity to meet him.
Yeah. Okay, well, we'll, again, we've had a lot of great people that work with us. He's one of those. And so we cherish his memory and all of the things he brought to the group.
Where will his memorial be? Or
I have no idea.
Because I know he was from Texas.
Yeah, he is, but I have no idea because that was not revealed to me. So if I find out any information, I'll share it with you. It's interesting, some of the newspaper articles in the Post on, I guess for the gentleman in the audience, they had this article about leaky pipes after 50, how you should never pass a restroom. Because you may need it. This is true for men, not so much for women, although incontinence occurs in women as well, but not as often. They also had an interesting article about how many people you think a year go to the emergency room because of sunburn. Any guesses?
I don't think anybody on this panel has done it.
I haven't been to the emergency room.
25%.
You'd be surprised.
I have had sunburn.
Did you go to the emergency room for it?
No.
Okay, that's well, all right.
Yeah. Most people of our complexion don't wind up in the emergency room, but many of us have gotten sunburns. How many of you have gotten sunburns? Yeah, I did too. I got sunburn.
Really?
Yeah. So
Every year.
So Black people get sunburn too. So Then there was an interesting
How
article,
many actually went to the emergency room? You didn't give us a number.
33,000.
Mm.
That's a lot, because probably when we get sunburned, we don't go to the emergency. We just let it peel off.
Mhm.
Don't sweat it. But 33,000 visits every year because of sunburn.
That's a lot.
Yeah, it is. And I suspect probably 95% of them are people who are light skinned.
What we need to know is how many of those 33,000 were black.
Yeah, that's what I was suggesting. I don't know, but I would imagine probably less than 1%.
But blackness is a broad horizon. We go from all the different shades there are. So in America, if it's 1/10 or 1/8 or 1/1,000,000th of a drop of black blood, so they say you're black. So what does that do?
It'd be interesting, as Darryl said, to find out in the data set how many of them said they were black. So, but I don't know that answer. So.
I still have enough sense not to go to the emergency room for a sunburn though. So, or even to let myself burn that bad.
Well,
I would suspect to be about 1% or 1/10 of 1%.
here's what black means in America. It means that you're at least an octoroon. And an octoroon is 12% black blood. At an octoroon level, you are capable of producing a very dark baby. And so that's why it's important in America.
Well, that's why it shouldn't be important. But anyway,
Well, you see,
because
passing blacks, but you know, it's like they wanted to make sure by birth certificate that it was racially marked, and so you didn't mess up, marry somebody who was really black, and you got a really dark baby.
yeah, which goes back to why race should be eliminated from the discussion. We're all the same race, different ethnicities and different complexions, yes, but all one race. I long for the days, I don't think I'll see it though, when race will become as unimportant as who you go to bed with, because these days your sexual preference is now newsworthy, which is a sad commentary on our country. It's no more necessary to know about this than it is to know what ethnicity you are. But hey, this is the world we live in, so that's what we learn to deal with. Okay, Buchanan, you can start the graphics. We have a number of interesting articles. And it's a good one to start with. The 7 scientists who helped change the world. It was amazing to me how many different ethnicities were represented here. This one, somebody who probably nobody even knows about. Electroengineering doctorate, who the father of fiber optic communication, which revolutionized the way we communicate. He got cables that allowed light to be traveled. And this then, of course, is won the Nobel Prize in Physics, but revolutionized all. Would you go back up to that for me? Because this is a marvelous achievement, because it revolutionized everything we know about communicating. And probably nobody heard about him before this presentation. Anyway, that's one. The next one is Tricia Bath, who is a African American who came up with the way
A
to
little bit later.
use laser to take out cataracts. This revolutionized the way in which cataract surgery has been done, and was the first to recognize the importance of glaucoma occurring in blacks and causing blindness. And she has done so much to revolutionize the way in which eye disorders and cataracts and blindness. She's Howard, one of the legends of African American and of scientists. How she revolutionized with the laser phaco probe, which she developed and patented. Very legendary character, and she's done so much. She died just 2 years ago in California. But she was a great mentor to many at Howard. And this is a Flossie Wong Stahl, who it's amazing how many of those people came from out of other countries and were immigrants. And she's a virologist, left Hong Kong and worked at the National Cancer Institute. How many know that she actually was the one who, part of the team that first identified HIV? And even though people never mention her name too often, she was one of the people who allowed us to know about HIV. And then this is the only one among them that actually I never quite understood the importance of the sonic booms, although I know about the sonic booms, but their fact that this then allowed flight trajectories and other things to occur. And she was one of those scientists at NASA that allowed us to understand why the sonic boom occurs. Plus, she got a doctorate from GW, which is interesting, and her work on ultrasound and shock waves is what was very important. And Charles Drew, of course, the inventor of the blood bank, who was interesting because he wasn't accepted at Howard because he didn't have enough English courses. And he went on to graduate from McGill and then became a chief resident at Freedman's Hospital, then went to Columbia, where he developed the blood banking mechanism under John Scudder, and then began the plasma process, which has been used since that point. And by the time the project concluded, there had been 14,000 blood donations. But what is interesting is that the reason he left the Red Cross is because they started segregating blood on the basis of ethnicity, and then called race. And for that reason, he felt that was inappropriate, and he then left the American Red Cross after he'd done this. And of course, this was one of the master developments. And this shows how he separated the cells from the blood, the plasma from the blood, and pooled that together to prevent bacterial contamination. This was the beginning of something that saved, now at this point, millions of lives. So this is one of the most important. It's appropriate that he is mentioned here. Next was George Carruthers, who world's first lunar telescope, and his ultraviolet camera allowed us to see out in space and look at the universe. Sometimes at first people thought we were the center of the universe. And we finally were able to look out and realize how little we are and how small we are when it comes to the universe. And it's always interesting to me as we have these explorations and we talk about trying to explore the universe. The universe is so vast. We have little likelihood of being able to really get into the depths of the universe. God's creation is so immense that it's beyond our knowledge at this point. Then there's Alice Ball. Interesting development is that she defined a new treatment for leprosy, but died before seeing the success of her work. And leprosy was a bane to the existence of all mankind up until the late 1930s. Actually, they had a compound, Shalmuga nut, that seemed to be able to treat leprosy to some degree, but not very much because it was able to be water soluble, and people taking it sometimes would help, but sometimes they had nausea and vomiting. But Ball revolutionized this and just identified a way to isolate the ingredient and then identified a water soluble injection as a treatment. And before her work could be published, she died, and somebody else tried to take credit for it. But when people finally recognized who it was, she'd already died. But she helped eliminate leprosy as a disease that was incurable. It's amazing how sometimes work that you do is not you're not giving credit for. It's interesting because, you know, in just as we talk about American history, we talk about American history because it was written by white people, and because we aren't, therefore, Black people were essentially written out of the history. And so if you don't tell your own story, it's likely not to be told. So this is why we have to play a major part. And that's why, for example, a lot of the things that are happening today in the 1619 rewrite issue that got a lot of notoriety become an issue because we're pretty much left out of the American history books. And now that they're rewriting them, and it's important that we tell our story the way we see it, not the way they saw it.
Did Charles Drew die because he was unable to get the technology that he developed?
That's not true, and that's a story that is untrue and needs to be debunked, because he died because he was in an automobile accident, and it was a fatal automobile accident. It had nothing to do with him receiving blood. But that's a myth that has been promulgated so that people talk about it and actually believe it, but it is far from the truth. He died from a tremendous automobile accident. He was driving, the car turned over, and he was fatally injured, and nothing could have saved his life. So that myth about not getting blood is just a myth. He died from an automobile accident and not from the need for blood transfusion.
Yeah, Dr. Callender, I just went to the eye doctor yesterday. I was having flashes and floaters, and my doctor got me in one day to get my eyes checked, and he said, "Well, I have I'm going to have cataracts." He said he could see cataracts already, so I might need this surgery from Dr. Bath, right?
Right, right, right. And that has been perfected so well that they do it under local.
Wow.
Yeah.
Wow.
Put that thing in, it grabs the cataract, pulls it out, and puts something else in. Takes about an hour and a half or so.
Wow.
Yeah.
And it's so funny, you talk about cataracts having to do with age. And recently, everyone around me had cataracts. Everyone was having surgeries. And so I went to my eye doctor to have my eyes examined. There's nothing wrong with your eyes. Don't come back next year, come back the following year. So I'm lucky.
You're blessed. You're very
Yeah.
blessed.
Yes.
Because you're right. Most people
Most people have.
over
Yeah.
60 have
Almost
cataracts.
everyone I know have had it or are planning now to have it.
Right, right.
Mhm.
It's almost as common in everybody as prostate enlargement is in
Yeah.
men. Yeah.
Mhm.
Okay, next one. Now this is an interesting article that will delight Darryl. Eat these foods to fight cognitive decline, and I don't think people will be too surprised about some of the foods that they mentioned. Always, blueberries seems to top the list. I'm not. It's funny. How many of you actually eat blueberries?
Every day.
Huh?
Every day.
Here. Yeah.
Oh,
Yeah,
good.
every
Good
day
for
for
you.
me too.
Really good. Well, you're on the right track. I tell you. I
Eating
don't
it
even know.
right now.
Huh?
I'm eating
Sylvia,
it right now.
Good. Good.
Sylvia, jump in.
Mhm.
Great. Great. Well, I don't know when I've had blueberries, but anyway,
Yeah, I was
they're
just
number one.
Maybe you just forgot.
But anyway, every list I've ever seen has blueberries at the top of them. And how that helps the memory, I don't know, but it certainly has chemicals which contribute to health. Second is the leafy greens, which we know well are good for us. But this talks in detail about 11 years younger in cognitive ages when they ate leafy greens compared to not eating the leafy greens.
I have kale and collard greens every day.
Mhm.
And then here's, I'm sorry, Chaplain Thorpe isn't here because here's her favorite,
Mhm.
turmeric, which is so common in India, and I think now you eat this too often, right? Turmeric.
Every day.
What are you trying to live forever?
No, just till 400.
Okay, all right, but it's interesting that and the number 4 was legumes, which of course vegetable oils are made out of it, and I think most of it. I think most people eat legumes, whether we call them that or not.
I eat legumes every day.
Yeah. So, brain healthy dietary choices play a role in slowing cognitive decline. So, grab a handful of blueberries, eat a healthy salad, top legumes, or spice up your cooking with turmeric. What do you have to lose? With mental health being such an issue. However, this is sobering when you look at this next article that talks about we're not going to live forever. We're born to die. So we might prolong it, but we're going to die. So, but you want to live as long as you can, and we're not finding the elixir of immortality, but we can live as long as we can and be healthy as long as we can by eating the right foods. It's interesting how lifespan has increased 3 months every year since the mid 1800s. But that doesn't mean we're going to find a way to live to be more than the 200 years of life. Of course, when you look back in the biblical terms and you see people living 900 years, you wonder if they had a different calendar at that time. And I don't know. But Methuselah was what, 969 years?
Yes, 969.
Yeah. So, and I always wondered whether they had a different calendar.
Yes, they did.
But in all honesty, that was before the flood.
Yeah, the current calendar that we use is based on an Earth solar year of 365 days a year, and that's antediluvian. That's after the flood. Before the flood, the calendar that was used is that a year was marked with every 3,600 solar years. And so you take the 969 and multiply it by 3,600, and you find out that Methuselah lived for hundreds of thousands of years.
Except that as a consequence of the flood, how do we really know that? Since it wiped out everything, how do we really know?
I'll have to give you the references after the meeting.
Yeah, please. I want to see that one.
Okay.
I always wondered about how people write about what happened before the flood, when everything was wiped out by the flood. And,
I think it had to be that long because in order for two people to start the world, they had to live a long time to propagate, even though they said Adam and Eve only had 3 children, but they had to have more than that, just to get the world started.
Now, this is interesting because we know that transplant patients, it's different. But this study found that 94% of cancer patients responded well to the COVID-19 vaccines. So it means that the cancer patients don't have to go through what the transplant patients have to go through, because they are able to mount an immune response, whereas many transplant patients have not been able to. And so while we need a third shot for transplant patients, we don't need it for the cancer patients. And of course, the high risk group, it points out, who receive this antibody, which is the same kind of thing that transplant patients get. Also, patients on chemotherapy had an attenuated response. So having cancer itself is not the issue. It's the other medications that they give you that are the issue, the same issues that you have for cancer patients. So the question is not whether you have cancer or not, but whether or not you have medication that reduces your ability to respond, your immune system's ability to respond to challenges. This is interesting, vaccine, no entry. Well, in many countries, that's not an issue anyway. They don't pay attention to the vaccine. If you're positive, you go in quarantine. If you're not positive, then you don't have to go in quarantine. Actually, in South Korea, it's a little different, because if you're whether you're vaccinated or not, if you're coming into the country, unless you're going to live in a family that already has been vaccinated, you have to be quarantined anyway. You just quarantine with your family. Now, I just I'm going to a funeral tomorrow of a lady who was about 84 years of age, who decided she didn't want to take the vaccine. And she actually died of COVID-19. And most of the people who are dying now of COVID are people who have not been vaccinated. So it's a wake-up call to remind us that we should be vaccinated. And as time goes on, it's going to be interesting to see what impact July the 4th has on everybody. As a lot of people really acted as though COVID didn't exist, which would be okay for those people who are vaccinated, but not for those people who aren't.
I was watching the broadcast on TV for the 4th of July, and maybe not even 1% of the people had masks on. I hardly saw anybody, but they were all outside. But wow.
Yeah, it's interesting. I actually went to my first movie, and although they said masks were optional, everybody had masks. I thought it was interesting.
Mm-hmm. I flew for the first time, and everybody had masks in the airport and the plane, except one lady didn't want to wear hers, and they made her put a mask on. But
yeah, I read an article about some high school students who refused to put on masks, so they canceled the flight.
wow, that's safe.
The Delta variant is a great interest to all because this is more highly transmissible than the other varieties of coronavirus. But the problem is that, as he's pointing out, most people in the world have not been vaccinated. And the place where this variant is going to show up is where people are not vaccinated. And the people at greatest risk in the United States are those people who have not been vaccinated, and that's where the variant is more likely to develop. 47% of the United States is vaccinated. We're still not up to the 60 to 70% that we would like it to be. And this variant is 60% more transmissible, but it's not necessarily more lethal, but it's certainly more transmissible. They are advising indoor settings to wear masks. Outdoors, there are not many people who think you need it outdoors, but indoors, they still say that. So Fauci says indoor, outdoor, you don't need a mask. But if you're going to be in a close area without good ventilation, then you should wear a mask. Now, this is a concern about going back to school. And this concern is because many of the children may not be vaccinated. If the children are not vaccinated, then this is the area in which the variant could become an issue. And so going back to school can be an issue for the teachers and the students if they're not vaccinated. They talk about an outbreak, another outbreak late fall and winter, unless they get vaccinated.
Dr. Callender, how long does it take to test that? 'Cause I heard they were just starting to test children with some of these.
What was your question?
How long does it take to actually test the efficacy of these vaccines on children?
Oh, it takes, they have to do, it's a volume thing. In other words, if they can test about the vaccine on about 10,000 children, then they can then safely know when they can proceed, and they working on that now. But I don't know how far they have gotten, because we're talking about under 12 now,
Right.
because the teens for the most part are over 12 are okay, but it's under 12 that more studies need to be done. And I don't know how far along they are, but I think it's important that we get that information before they start school back again. Now, this is an issue that's come up. If you receive Johnson & Johnson, should you get a booster shot? And it's clear that the two-shot vaccines protect you against the Delta variant, but it's not clear as to whether the Johnson & Johnson does. And should you therefore get a second booster shot from the Pfizer or Moderna? And most people who don't know, since we don't know, suggest that it's a wise thing to do, because having a higher antibody level is not going to hurt, and it may help. And the studies on Johnson & Johnson have not yet been completed to identify its safety against the Delta variant. And as soon as those studies are finished, we'll know. But right now, we don't know. And I don't know. John, did you include that article on Novavirus?
Yes, it's coming up.
Okay, all right. So we'll see another vaccine that maybe answer the question. Right. But the bottom line is that if you got one shot, it wouldn't hurt to get a second shot, especially if you're above 50. Good question. Should the Delta variant change the United States pandemic playbook? I think the most important thing is that we get vaccinated. And if we get vaccinated, then it probably doesn't matter. But if we have a significant number of people who are not vaccinated, then that raises a question. So it's going to be interesting to see how with time, whether they change. But right now, the advice is get vaccinated. Now, it would be true if the vaccine wasn't effective, then you should need it. But all of the studies demonstrate that the Moderna and Pfizer vaccines are effective against the Delta variant. So different opinions about it. So There's a lot of different opinions. Uh, Probably the wisest one is if you have 2 shots, you're probably okay. If you had 1 shot, it makes sense to get a second shot. But we don't really know the answer to the question. And here again, she should be wearing a mask indoors. World Health Organization says yes. Now it's interesting to say this and then also open up all of the sports arenas inside sports arenas. There's a contradiction in term.
I was watching the Padres game last night, and I didn't see anybody in the whole stadium, and the stadium was packed. It was outdoors, but I didn't see anybody with a mask on.
I think the outdoors, most people can understand. Indoors is another story. And probably one of the best things to do if you're going to have indoors is to make sure everybody who comes in is vaccinated.
Dr. Callender, we were on a call yesterday and we were talking about choir rehearsals, indoors versus outdoors. And everybody agreed that, outdoors is probably safer. However, when the summer is over with and the cold weather starts coming in, we're going to have to come in indoors. So I guess choir rehearsals is going to have to take another break.
Well, I don't think so. I think if everybody's vaccinated, it doesn't matter. This should be sure everybody's vaccinated.
You know, my concern, Doc, is with the folks who are vaccinated who still can carry the virus, what do you call it, asymptomatically, and give it to somebody else.
Yeah, well, that's a concern, but it's a minor concern. I think if everybody's vaccinated, there isn't a need for concern about the transmission of the virus as long as the place is adequately ventilated. I mean, that's a theoretical concern. It's not really a legit concern in the long term if you have somebody who's been vaccinated, fully vaccinated. But this will go on. But anyway, I think that if everybody's vaccinated, indoors okay. If everybody's vaccinated.
Well, you remember the basketball player? What's his name? Chris.
Yes,
Paul,
I do. Yes, I do.
You know, who tested positive, but he was fully vaccinated.
Right, that's correct. And didn't say that can't happen, but I think that it's something that can be expected, that is 95% effective, and there's going to be exceptions to every rule, but it's to be a rare occasion. And this is an article that talks about how the unvaccinated become a weapon against everybody else, because that's where the mutations come from. And so the more people that are vaccinated, the better off we are. And it talks about the 4 variants, and Delta being the one that poses the greatest risk of transmission. It's interesting. 1,000 counties have vaccination coverage less than 30%. Southeast and Midwest. And those are the areas where the variant is going to be a problem. But the way to stop the spread is to get vaccinated. That's a lot of counties. This is interesting work that comes from the UK that talks about deaths of people who have been vaccinated. 117 deaths. The overall death rate was 0.13%, which is okay if you're in the other group, but if you're in the 0.13%, it's 100% for you. So, and those who are fully vaccinated, 50 died, which may be a very small number, but if you're in that number, it doesn't matter. Now, what it should have is the number of people who actually were vaccinated, but it doesn't have that number. But anyway. So, and one of the things that is clear is that by the time September and October run around, we should have enough data to be able to answer some of these questions optimally, which we can't do right now because we don't have all the data. But many churches are opening up now, but I know my church is opening up in September. What about your churches? Any other churches opening up?
Yeah, my church is open up. Liberty Baptist Church is open.
They opened up already?
Yeah.
Anybody else?
I'm playing for a church that's open up, but they have a small congregation anyway, so it doesn't matter.
The same with Liberty, is a small congregation. 50 people is fully opened up for us.
Yeah, okay, 50 people, yeah, okay.
Yeah, Springfield is opening up on the 18th, but they have 2 campuses, and the smaller campus is the one that's opening up on the 18th. The main campus is opening up on the first Sunday in August.
First Sunday in what?
August.
August, okay. Yeah. This is interesting because the Novavax is the last vaccine to come around, and there are reports that maybe that may be the best vaccine of all. But since it's the last, it hasn't gotten the publicity that you would have in others, and it's very effective. It's well against the variants. So just another vaccine, which has been 90% even against the coronavirus variants. And so this is something that is good to know about anyway.
They're right up in Gaithersburg, or Germantown or Gaithersburg, Maryland.
Right. Matter of fact, Howard was involved in that vaccine study as well. And that's using the old technology. So it's interesting to watch and see what happens with this. So we've got good vaccines. So now we need to see which is best. Now also the fact that the vaccines are giving us long-term antibody protection is important as well. So it's going to be interesting to see what happens as a consequence. It's probably nothing because it's occurring so late. And in many ways, this is about the time you'd expect to be able to using the old technology to come up with a vaccine. It's hard to tell how many lives have been saved because of this new technology. Any questions about this? I don't know how it matters to us today, but as time goes on, as we do more studies, we'll learn more about both of these, all of these vaccines.
Is the Novavax the same technology as the other ones? Is that the
No.
same messenger? What's the source of the efficacy in Novavax?
I think the difference was that they did not use the mRNA technology.
Do you know what they use, or?
I don't know. It may tell you. I don't know. And it's interesting to look at the difference between the side effects, although the side effects are pretty minor, but they had fewer side effects as well. And the other disadvantage, of course, is the refrigeration you need for the Pfizer vaccine. You don't need it as much for the Moderna, but you need it for the Pfizer vaccine. So it makes it more easily available.
That's it for the articles.
Okay. Any questions about any of these articles?
I was wondering, as they come up with new vaccines, the government pays equal amount for all of them since we don't have to pay for them, and it's just how many they can sell commercially, or how does that work? Because
I only know about Moderna and Pfizer. I don't, and I know for Johnson & Johnson, there was no cost. I don't know about for Novavax.
Okay, but of course, the government pays for all of this, right?
I don't know about Novavax. I know for the others they did. Carol, you want to tell us about that article you sent around?
Oh, I found it on Facebook about, like they were saying before, there's history that they're just now discovering or among us, and the history, Darryl is killing me, the history of Blacks of these different lakes. Our people, they have tried to kill us off all sorts of ways. They burned up our cities that they're discovering. And Malcolm X, when he told us that we should patronize each other, start our own states and countries, we actually started that. Even during the time when they brought slaves over here, they revolted and destroyed whole villages of white men. They did not stand idly by and be enslaved. We actually fought against all of this. So now there's certain ways, and my brother and I, we were just remembering about our grandparents' home in Indiana. They put a road through there, a major highway, brought up the whole community, put a major road through there. So we don't even know where our grandparents' home is. It's over some particular road. Same thing about lakes. When Blacks, they got tired of us and they named it, you see this beautiful lake, and underneath the lake are Black cities. So they have tried, and we don't know, thinking about it, did they get together and plan this? We're going to burn them, lynch them, and put their towns in underwater or what? How is this systematic?
Well, now, why would you ask that question? Obviously, they got together and planned. It's not a question. You know the answer to that.
Okay, all right.
I mean, that it's just like a lot of the policies. They're deliberately done in order to put us down. So you know, it's interesting that that article points out that this is why reparations for blacks is something that you should consider seriously, because it's not an accident that these things happen. They're planned.
I saw another article about New York of how they started the ghettos. It was actually started in like enslavement of crop sharers. It was actually planned how they could create a slum and that they would not be able to get out of it. Then Central Park is another evidence of how they have tried to do. And I have some nieces that live in New York, and their lakes and different parts of New York. We're talking about the North. These are planned ways to get rid of us when we congregated in one community. So now they gave us the city and they're taking the city back. They gave us the suburbs, and eventually they're going to take the suburbs back. They do all sorts of things to get rid of us, to disperse us. They created the jail system, made rules they think would enslave Black people, put our boys in jail, the same thing that their boys have been doing all along is youth. And then they have us turning on each other, our vernacular, what we call each other, how we think that Black people are lazy, and etc. All of that is a way for us to destroy each other internally, as well as they're exploiting us externally. So they made us have, not made us, but they created in us a self-hatred of even being the color that we are. So this lake is just another issue that we're just now discovering that the Caucasian race has done. But if you look in Africa, my brother was telling me this, if anybody was an albino, they killed them. Anybody that looked like a white man, they killed them. So is this just the reverse? Darryl could elaborate because he gave me a long talk about what they did in Africa to white people.
Well, I think basically, I think humans are the same. I think blacks are good and bad, and whites are good and bad, and you have good and bad in all groups. And the problem is that institutionalized racism and ethnicism and whatever you call it is everywhere. We see it in the United States, but we see it everywhere, you know. And I remember going to not Australia, Brazil. And it was interesting that most of the country was Black. A lot of the country was Black, but the people who ran the country were all white or pretty light skinned. And that was true in many countries. People of color discriminated against. And this is something that is worldwide. And it's something that I think maybe we get from Cain. I don't know, but it's human nature. And so I don't laud any ethnic group because I think they're good and bad in all ethnic groups.
Well, okay, let me say this about that. Oh, I got something. Okay, on my screen. Black, the ones that made the transatlantic slave passage from 1600s to the early 1800s, us. And for the most part, we're in North America, Central America, South America. And our numbers are currently about 100 million souls. And despite human nature, there is no group on earth that's treated worse or despised more than us.
Well, I just think that people of color are treated bad wherever they are. Uh, yeah, and so that doesn't change what I said, because the only question is, why is it that it's almost worldwide that people of color are treated differently? Because when I was doing one of my articles on worldwide donation rates and looking at why people want to donate and why they don't want to donate, I was able to identify that wherever people of color were, they had the same mentality because they were discriminated against. And it doesn't change what you said, because it's still true that people of color, for some reason, people really believe that white is right, and if you're black, you must step back. And so we need to get that false truth eliminated, and recognize that diversity is what's good for humankind. Diversity. The more diverse we are, the better off we are. The more likely we are to survive.
The other thing, Dr. Callender, is of the misconception is that they say that the darker the berry, the sweeter the juice. But and what we're talking about now, the misconception is that the darker your skin is, the dumber you are.
Yeah, that's the misconception. Yes.
Yeah.
Yeah, and black is beautiful came about because they said the opposite. Black is dumb, black is ugly. But of course, the stock market has it right. Black is wonderful. I mean, and you're black, you're doing well. If you're not, then you're doing poorly. But still, diversity begets ingenuity, and that's what is the salvation of the human race, is its diversity. And the sooner we learn to recognize that that's one of our greatest strengths, the better off we will be.
Dr. Callender, you were telling us a while ago about some of the stories about the experiences that you had in medical school, where they tried their best to discriminate against you, but weren't successful.
Well, in medical school, that's different because I went to a black medical school. But actually, when I was at Hunter College, which is predominantly Jewish college, that's when I was unaware of the fact that the scales were fixed. And I didn't realize that until I went to Meharry, which was a historically black college. And then I realized that I didn't know all the things that were going on. I was just on the outside looking in.
I went to a school, a college where the racism was covert. And then right after that, I went to a college where the racism was overt. And the covert racism, I wasn't even aware of it. I didn't even know it was happening.
Yeah, yeah,
But
yeah.
when I got to the University of Maryland, where the racism was overt, it was like in your face.
Yeah, yeah, yeah. That's right, right. That was my experience at Hunter. It was covert, and I didn't even realize it either. But my opposite was when I went to the historically black college. It was then that I realized what had been going on. So I had the opposite uh, issue that you had. I went from covert to novert. And yeah, you went from covert to overt.
Yeah.
Yeah, and that's radically different. But
One other quick story. Wynton Marcellus told us, my family, and that's about a story that he had when he would be in a group, a musical group, and everything's going well, and the trumpet player's sitting right to his left, or maybe even on the right side of him. As soon as it came time for him to play a solo, they would holler the word miss in his ear, hoping that he would mess the solo up.
Really?
Yes, sir.
That's kind of bad. Yeah, you know, the other thing that I will bring up is there's an article that I started to send, but I figure we had too many, which in the state of Maryland, 100% of the patients who died from COVID this last month were unvaccinated. 100%, showing the real importance of getting everybody that can be vaccinated, which is in their best interests and all of our best interests. So in DC, it was 80%, but in Maryland, on our newly released data, it was 100% of the deaths were in unvaccinated Marylanders.
You know, Dr. Callender, just to talk about that again briefly, there is a group of people, the no vaxxers and the no maskers, who refuse to do any of that. Out of, you can't, you know, the government, you can't tell me what to do. And that's the ones, those are the ones that I'm concerned about. I would say afraid. My wife is more afraid than I am, but I'm still concerned about people who refuse to get vaccinated and refuse to wear masks. And there's hardly anything you can do to make them, because that's their mindset. You know, so, you know, wearing masks on the inside, I'm for that. I ate at a restaurant last week with 10 of my friends who are all vaccinated and no masks. So I was comfortable about that. A month ago, we did the same thing. But to be in an environment where you don't know, and then who's going to say, are you vaccinated? You know, is that a form of discrimination also?
Food for thought. And I think that any other comments, any other ideas about that?
I have a friend who I was talking to also on this conference last night. She's in the medical field. She's vaccinated, but it seemed like she got the same type of fear she had before she got vaccinated, like a henny penny. You know, you can't do this, you can't do that. You're vaccinated, but you're going to get the Delta vac and blah blah blah. So I'm seeing this frenzy that she has about people even thinking about getting together. And I'm saying, wow, when would this end? She's vaccinated, but still upset that people even thinking about getting together. So,
Well, I think, and for many of us, it's going to be next year before people will be really comfortable, because by that time, everything will be resolved. But I think the next 3 to 4 months is going to be interesting. Remember, we talked about the anxiety about getting back to normal. And there's going to be a lot of anxiety and mental health issues that come to the fore over the next 30 to 90 days.
so I shouldn't feel I feel comfortable about getting back together, but I guess I shouldn't. Is that ignorance or what is it? I mean, I feel sort of a little bit more relaxed than, and my son, he says no mask, he's vaccinated. And if the store says don't wear a mask. And so how should we really feel about this?
Well, my feeling is that it's clear that if you're vaccinated, you don't need a mask outdoors. Indoors, the bigger the group, the less ventilation, the more important it is for you to wear a mask. That's my sentiment. Now, for example, if you have a choir rehearsal indoors for a group that everybody is actually vaccinated, then I think that's reasonable. So because you're going to be leading a choir and all that stuff, a band or whatever, I think it's important to ensure that those people who are going to be in that group bring their vaccination card with them. document the fact that they are actually vaccinated. And if they do that, then it seems to me to be okay. If not, then it's risky.
I got a question over the people that said that their churches are opening up. Are they bringing back the choirs, or they still got praise teams and soloists? How are they opening up?
I don't know, because does anybody know?
At Springfield, they are going to just use soloist for the first few Sundays that it will be open, just to get a feel for how things are going to be managed and handled, and how well people attending the church services will be managing the guidelines. But they will not be using choirs right away. In answer to your
That
question.
makes sense.
That's
Any other?
That's the same thing at Liberty. We're kind of testing the waters to see for July and August. We're just gonna kind of see how many people come, and we're just using soloists or the praise team. Usually it's just a soloist and one selection, and then we're gonna see, and hopefully if everything goes well, they're supposed to try to open kind of more fully in September. But we're just checking it out for July and August.
Yeah, that makes sense. Yeah. Okay, well, we've covered the waterfront. Thank you very much, and let's all remember Dr. Robinson fondly and all of the things he did for us and how he made the group better by his participation.